Well, here we are. Um, Welcome, everybody. This is Lunch with Helena, and our topic today is Ferguson, a Ferguson COVID-19 testing site that was up and running last week. And our special guest today is Don Logue. He is a public health advocate. For those of you who don't know me, I'm running for state representative. My name is Helena Webb. I'm running in District 100, which is the Baldwin and Chesterfield area, and I'm offering a series of informational videos so that we can connect with people who are doing really good work in our area and who are experts on different topics. And appearances are not an endorsement, but this is a way to share information and make sure that we stay connected during this time and in sort of a less political, more informative way than we get on the news many times. So I'm going to stop sharing my screen and welcome Don Logue. Hi, Don. How are you? You can share your video and we'll be able to get started live.
Oh, okay.
Wonderful. Hey, thank you so much for being here.
You're welcome.
So, Don, tell us a little bit about your background. You have a really wide range of experience, and I think it's important that we all know sort of where you come from.
Well, I think to start with, as with all of us, it's family, and my family's involved in social entrepreneurship, and that we owned a telephone company, a small independent telephone company in East Central Illinois. And so from a family standpoint, we were always involved in community economic development and community service. That led to, after graduate school, I had the good fortune to work for Aladdin Industries in Nashville, Tennessee, whose owner there was the community leader that spearheaded the creation of metro government in Nashville, and also was involved not just in international manufacturing and export of products, but also in redevelopment of the physical infrastructure and nature of the community there. He created Metro Center, Newtown, Intown.
Mm-hmm.
That piqued my interest in moving back to Illinois. As it turned out, it ended up being Springfield, Illinois, to get involved in commercial real estate and community development. And my family also, as part of its social entrepreneurship, had always had a tradition of political involvement on both sides of the aisle. And so that's what I got involved in Springfield, became a public official there, responsible for economic development during the recession of the early 80s, when we had to cut the city budget by 30%. And we had 11% plus unemployment in the community. So my job was to put people back to work. I left there to move to St. Louis and worked for another extraordinary person, Richard Barron, who created McCormick Barron Associates along with Terry McCormick, created an extraordinary company involved in developing affordable housing, not only across the country, but also internationally. And I left there to get involved in senior housing and healthcare, because I wanted to take those same principles and apply it to providing healthcare to the most underserved populations across our country. And so that's
Great.
And now I'm a public health advocate. I work with different organizations and local leaders and state leaders to try to advance the cause of good public health.
Yeah, we have a lot of kind of systemic problems throughout Missouri that I think are holding us back from lifting up certain populations or giving them the opportunity to lift themselves up. We want them to do that, and we want them to be able to do it, but we have a lot of roadblocks. And I know that you have also been an advocate in Jefferson City. Could you just give us a snapshot of what you may have been advocating for?
Well, in 2008, I exited being a direct care provider in the nursing home industry. And I did that because I felt like I believed that our job in healthcare is not to force people into institutionalized living. Our mission is to keep people out of the doctor's office, actually, and out of the hospital and out of nursing homes. And so I began this quest of how can we do that, and in particular using technology. And along the way, I began working with the Adult Day Service Association, which is a healthcare delivery model that allows older adults and people with disabilities to continue to live at home with their families, but get the services they need on a Monday through Friday basis that the families couldn't otherwise provide. So I began working, and I've shuttled back and forth between Washington and Jeff City over this past 12 years to try to advance an understanding of how we can be more innovative in delivering healthcare, again, that keeps people healthy as opposed to being reactionary, that leads to really the pandemic we're facing today.
Well, we know that keeping people healthy from the beginning, a healthy birth, healthy life, has better outcomes for people, and it's more cost efficient if we can just understand the value in that. And also, I agree, there's this problem right now with COVID-19 where our healthcare system was stripped so bare, especially in states like Missouri, who sort of don't want to provide as many services as some other states to the general population. Now we have a lot of people who need help, and we have a very bare bones structure in place, I think. I mean, St. Louis is blessed with amazing hospitals and doctors and nurses, but we can't say the same for the entire state. But let's move on to the COVID-19 testing site that you worked at. I understand it was in Ferguson, and I understand it was one of the first testing sites in North St. Louis and North County, and that there are more opening up now. But tell me about that first experience for you, and how did you get involved?
Well, I'm on the board of an organization called Community Forward, Inc. The chairman of that group is Ella Jones, who's a Ferguson City Council woman, running for mayor, by the way. And our focus was to create a livable community vision for North County communities. And of course, my principal role in that was to focus on how do we build up the healthcare infrastructure in North County. And so we were looking for opportunities to see more testing done in the neighborhoods. One of the key problems we have in healthcare is that we focused on making everybody go to the hospital, go to the clinic. Well, 20% of the households in these North County communities don't have cars. So you can see immediately there's a tremendous access problem. So this was an effort to try to bring testing from the walls of the hospital and into the neighborhoods where we believe, and it's being confirmed, that we have high rates of infection.
Yeah, and so who came? So you were.
I showed up as a volunteer. I wasn't expecting to be a direct care participant.
You weren't?
But the doctor said, we need someone to handle intake.
Okay.
And you've got a healthcare background, so
here's scary? Was that scary?
Well, I am a high risk. I'm 69. I have coronary artery disease. Other people in my family, have a degree of risk. So the logical thing was not to do this, but like everybody else, sometimes we have to step up and take a certain degree of risk in order to advance the needs of the community. And so, and of course, I had that ethic, so to speak, from a family standpoint. So I stepped up, and it was, it was sobering. It's always rewarding to help people who are in fear, who need help. And so it was great to see that people were able to have access to testing that otherwise were being screened out of the system for a variety of reasons.
Was it just, I know we're really only screening certain folks still at this point, depending on the symptoms they're presenting, and we're finding out there are so many other symptoms that we could be looking for, and conditions that are attached to this. But was it people just from the Ferguson community who came through? Were there people from outside the community? What was the client base?
Well, our objective was to try again to really target the Ferguson community, which predominantly uh, that was the case. But we had people from St. Charles County, we had people from West County, and a variety of um, demographics, I'd say, in that regard. Um, uh, Predominantly minority for those coming from the North County area and North City. We had people coming from North City as well.
Okay.
Um, and the hours were 6 to 9, so I think that was an a.m., so that was another influencing factor. We had a lot of people on their way to work that either were experiencing symptoms or had been exposed to someone else who had tested positive. Now, the criteria, and all these individuals were wasn't an absolute requirement, but all these individuals came for the most part through a call center where they were pre-screened. And I would have to say that the screening for this site was more uh, expansive, less restrictive than those at the hospital in the hospital settings.
Mm-hmm.
So, hospitals are, for the most, I'm not going to speak for them, but from what I understand, they're testing to confirm diagnosis. People who, and I think the governor actually spoke to this morning, or Sam Page, and that is that they're testing people who are symptomatic, who have obvious symptoms being displayed, where in our particular case, we were testing people who thought they had been exposed.
Right, who don't want to get their families sick, or a lot of people care for an elderly parent or something of that nature, and they want to make sure they're safe to do that.
And they were trying to make decisions as to, do I go to work or not? And so, the physician, the doctor, the medical director on site was counseling them. But this, they get the test, and then they, have these additional questions, and so it was an opportunity to also educate and answer those questions firsthand.
So I mean, in closing, sort of, what was your takeaway from this experience, and what did you find anything positive about it? Did you find that there was still a need that needs to be addressed? What were your takeaways from working with those people who were concerned about being exposed to COVID-19?
So it was a step in the right direction. And quite frankly, the governor and the county executive, and they've openly discussed this in the last few days, they are relying upon these types of public-private partnership, community initiatives to do this testing, because everybody's scrambling to get test kits and supplies. Mm-hmm. And it's a extremely difficult logistical problem. In this particular case, we found an organization that had access to 500 kits. And so, those are going to be used up here over the next 2 to 3, 4 weeks, unless we can get access to more. But it's a step in the right direction. But it also allows us to begin the discussion of, how do we develop a more proactive public health system that doesn't rely on testing alone. And we have all this wonderful technology that's being used in all other areas that we haven't brought to bear on this crisis, and that's beginning to cultivate. And we've got a lot of entrepreneurs working on this, so that we can monitor people 24/7, 365, and begin to pick up signs that diseases are developing, because we have to prepare for the next pandemic.
Well, we have to prepare for the continuation of this one. I mean, we are
Absolutely.
not going to get we do need to go back to work. We do need our economy to not completely collapse. Nobody wants to be in a depression over this, but we also don't want our mothers to die and our children to die. So we have to figure out a way to move forward that's responsible, that makes sense, and that has a forward thinking plan, because just reacting to what's going on today or yesterday or tomorrow, or what people are saying as opposed to what's really happening, that's really a problem, I think. And I do think this is an opportunity for America to, buckle down and look at the future. The world, although right now we're contracting and we'll be bringing some business home to America, which is what people wanted. They probably didn't want this to happen, to force that issue. But, this is going to happen again. This is a good opportunity for us to build a framework for dealing with this, because there will be another and there will be another. When Ebola came, everybody was very frightened for a short period of time, and Zika virus and things like that. These things are going to come. We have a global world, a global community. We can't get away from that. So I agree with you. I think putting in place a structure where we can actually take care of ourselves, our neighbors, our family, is hugely important. And I think that government plays a role in that. I don't think we can just leave it up to the entrepreneurs. Thank goodness for those techie people who are working on apps and solutions to these problems. I think that's amazing. And my limited work I work in the healthcare industry from a distance, but getting a drug approved, getting it tested, these things take a long time. And even if we fast track things, there is no magic bullet that's going to appear in the next, month to get our economy back on track. It just doesn't work like that. Science can't really be rushed in that way. I'm glad that the government is throwing money at this and hiring people to develop a vaccine and treatments, but it's not going to be fast. And we have to be able to survive this pandemic and the next one. So thanks for giving me an opportunity to say to say how I feel about this. I appreciate that, Don. I guess that's it. Thanks so much for being here. And I'm looking forward to continue listening to what you have to say and working with you. I know you study everything from a data standpoint. You look at facts and trends, and I know that economic development is your priority, and I really appreciate that. So thanks for being here, Don, Logue.
Thank you.
And I'm Helena Webb signing off from Lunch with Helena. And thanks for coming. Take care. Stay safe.